You're welcome to my channel. Today, I will continue on schistosomiasis, but it's going to be about the treatment of schistosomiasis. If you haven't listened to the previous presentations on schistosomiasis, please kindly do. Without further ado, let's go. Now, like I said, if you haven't listened to the previous presentations, please kindly do, because that will be helpful in understanding why certain measures will be taken when it comes to the treatment. For example, let's go through the life cycle together by clicking on this very link, and also differential diagnosis by clicking on this very link. If somebody should ask, what is your goal by treating anyone with schistosomiasis? The first target is through the life cycle, and it will be to decrease the egg production. We cannot do that without reducing the adult worm load. If you want to understand this better, why the egg production is pretty important to the treatment, and getting rid of adult worm before we can decrease egg production, please kindly click on that very link that will take you to the life cycle of schistosomiasis. Then, Praziquantel given once is enough for many patients, but repeat treatment may be required under certain situations, like in endemic zones, in refractory Schistosoma mansoni, in a woman of childbearing age with perennial bleeding, in failed treatment the first time, and also in Neuro Schistosomiasis. There may be repeat treatment. Decrease peri-portal fibrosis will be our goal when we want to prevent portal hypertension. We will also treat because we want to prevent some major complications like neuroschistosomiasis, cancer in long-standing schistosomiasis like bladder carcinoma. We don't want renal failure to set in, and infertility will become too much of a burden to people of childbearing age. We would like to reverse some reversible complications as well, like anemia, malnutrition, fever, body pain, and so on. Now, because we will go through the signs and symptoms before determining certain investigations to be done and then the treatment, so it is going to be very helpful if we can click on this link that will take us to full presentation on clinical features or signs and symptoms of schistosomiasis. Click on this, please. Also, prevention and control. You will get that through this very link. Now, the treatment. Who should be treated? It's not everybody who must have traveled to the endemic zones that will be treated in the non-endemic zone. But someone, exhibiting some signs and symptoms or laboratory investigations showing complete blood count with eosinophilia, with history of travel to the endemic zone, you can then begin to suspect and do certain investigations. But if those investigations are pointing to negative, you don't treat. If the eggs or the immunological, serological investigations are pointing to the presence of any of the species, then you treat. The first agent, the drug of choice here is Praziquantel, but it depends on the presentation. We might start with corticosteroid first before Praziquantel. Then, it's not everybody that could be given Praziquantel immediately. It has to take time. We don't use Praziquantel until it's about 6 to 8 weeks. Some authorities will put it 6 to 12 weeks of contact with Secaria. whether Praziquantel is helpful to kill only the adult worm. Praziquantel will not do anything to the eggs. So it's like wasting the money of the patient if adult worms are not yet in the system and we give Praziquantel. Let me give you a brief note on Praziquantel. And why is that very important? I will tell you why it is important. In fact, I'm going to make a separate presentation on Praziquantel. Praziquantel is very active against Schistosomiasis, against the adult worm only. And as a matter of fact, it is the drug of choice. It will be given between 6 to 8 weeks post-infection or post-contact with the freshwater harboring the snail with Cercaria contamination. Usually, Praziquantel will be given once, a single treatment. That will be curative in most patients. But a repeat dose will become necessary 2 to 4 weeks after the first dose in some certain situations. I've given an example before. We will then find out how well we are doing after administering Praziquantel by examining for the eggs of the particular species that must have been diagnosed earlier. And that could be done within 1 to 2 months after the onset of Praziquantel administration. So there is a little bit of controversies about the age limit as per who can use Praziquantel. Some authorities believe that anyone less than 4 years should not use Praziquantel. And some believe that pregnant women should not. But the World Health Organization is okay that anyone that is 1 year and older can use Praziquantel. And also, the World Health Organization is very much okay that a pregnant woman can use Praziquantel. As a matter of fact, Praziquantel is categorized as pregnancy category B. Praziquantel can be used in pregnancy for mass prevention, but we have to weigh the benefits and the risk to the mother and the infant. If you are confused, please contact your pharmacist. So generally, whether World Health Organization or some authorities, anyone 4 years and above can use Praziquantel. However, since I will not be there when you'll be taking that decision, contact your epidemiologist or your pharmacist. Better still, contact both. Now, the medications that will be required for the treatment of schistosomiasis will include corticosteroid, and that is the first drug we're likely going to use when we are faced with the inflammatory processes or antigen-antibody reactions following the antigen release by the adult worm and the eggs. But that is not curative. That is just going to stop the inflammatory process. Then we'll go for Praziquantel, which is the drug of choice, when we believe that it is now 6 to 8 weeks post-contact with the Cercaria, meaning the time we believe that the mature worms will have developed, because Praziquantel will only kill the adult worm. It has nothing to do with the eggs. But corticosteroid will ameliorate the effects of inflammatory process going on because of the eggs or the antigen from the adult worm. Oxamniquine is helpful as second group of, and the second choice rather, for refractory Schistosoma mansoni. And that is why I said earlier, Praziquantel could be given the second time in refractory Schistosoma mansoni, but you can employ the services of Oxamniquine for that same purpose. Artemisinin derivatives will also be helpful, but it's not the first drug of choice. Although I will still tell you to contact your pharmacist, parasitologist, or epidemiologist, or better still, contact all of them. There is that synergistic effect when you are faced with difficult conditions involving schistosomiasis. Though in neuroschistosomiasis and the first inflammatory processes that will occur, you are still going to use corticosteroid. Then, when you want to treat the adult worm, you can combine Praziquantel with Oxamniquine, or combine Praziquantel with Artemisinin derivative. We will make use of beta blockers when we are battling with certain complications, like portal hypertension, pulmonary hypertension. Anti-epileptic drugs or anticonvulsants will be helpful in Schistosomiasis when we are faced with schistosoma. Antipyretics, if there's fever. Remember, I've said that during the presentation on clinical signs and symptoms that nocturnal fever is likely going to be the case, but mostly there may be no fever. Analgesics in case of myalgia, antipuritic agents in swimmers itch, antibiotics when there's secondary bacterial infection. We use antibiotics. Special cases will include a woman of childbearing age with perineal bleeding. In that case, we will repeat Praziquantel and monitor again. So why are we doing that? We don't want the woman to come down with infertility later in life. So repeat treatment will be fine in genital involvement with a female leading to perineal bleeding. Here, we can have repeat dose of Praziquantel. Also in splenomegaly, we can just have splenectomy. In varicose bleeding, that is secondary to portal hypertension, the treatment of choice here will be potassium shunt or devascularization with splenectomy, and we can add beta blockers. But first thing first, we must handle the adult worm with Praziquantel and decrease inflammatory process with corticosteroids. In neuroschistosomiasis, we will give prednisone 1 to 2 mg per kilogram per day. And why am I bringing this out separately? Because I've mentioned corticosteroids repeatedly right now, but it is important when it comes to neuroschistosomiasis that will be on that prednisone for a long time. It's going to take several months. And we must remember that we cannot stop the prednisolone suddenly, or prednisone. We can't stop it suddenly. It must be tailed off, okay? Then we will give Praziquantel daily for 3 days if it is neuroschistosomiasis. Unlike majority of the affected individuals that will take Praziquantel once, in neuroschistosomiasis, Praziquantel every day for 3 days. Also, prednisone every day for several months, and then we tail off after. Remember, we will also look for anti-seizures, anti-epileptic drugs if we are faced with seizures in neuroschistosomiasis. Finally, monitoring, because it won't be a good practice if we don't follow up and we don't monitor how successful the treatment would have been. So for us to get this right, let's go back to the clinical features of schistosomiasis or signs and symptoms. Please click on this very link. So the first thing first, the clinical features in this patient. Then another thing to monitor will be complete blood count with differentials. And our target will be eosinophils. Eosinophils will increase shortly after the treatment, then will start dropping after several weeks. Increase of more than 3 months is indicating that the parasite burden has not been reduced enough, meaning we are not winning. So it may not be pointing to another parasite entirely. So they found that we have schistosomiasis, the eggs already diagnosed, and then the species is confirmed, serological investigations already done, and we've given Praziquantel, we've even repeated the dose, steroids have been given, any other agents have been given, then we are monitoring today, and the value of eosinophil is still high, although it will be appropriate to have microscopy done again, looking for the X that will be specific to the species, and then the stool or urine, for that purpose. Then we can do that up to 2 to 4 weeks after treatment. Even we can have serological investigations done. If we find viable eggs in 6 to 2 weeks after the first treatment, then we have to repeat Praziquantel. Let me repeat. If viable eggs are found within 6 to 12 weeks post-treatment, then it means we are not winning. We'll repeat Praziquantel. Okay? But the high level of eosinophil may be pointing to another parasite entirely. So we can have radiological investigations done and other tests that will be listed under how to diagnose schistosomiasis. But it may not be so necessary to go over all of them. The best tool for monitoring treatment is the circulating anodic antigen, and that will be peaked in the serum and the urine. And finally, let me repeat here, the fact that the drug of choice is Praziquantel, that could be given once and be curative, doesn't mean that is the only thing we can do. Sometimes we may not be winning, and when we are not winning, we'll do certain investigations to establish that we still have eggs production that is ongoing, and then immunological investigations will also point to the same, and we can repeat Praziquantel. In all this, discuss with your epidemiologist and parasitologist if that is the case in your center, and pharmacologist. Thanks for listening. Please remember to subscribe to my channel. Remember to share this presentation. I appreciate it.